Welcome to today's Medicare 360 show. I'm your host, Jennifer Lee, and we are going to get started. It is October 13th, and so we're 2 more days out from annual enrollment for Medicare. Today, I'll be talking about annual enrollment period and what's changing for Medicare in 2026. So, today we're going to unpack everything beneficiaries and agents need to know for the annual enrollment period 2026. We're going to talk about government rule changes, carrier and star rating shifts, new tech trends, and how agents and agencies should adapt. Stick around, and I'll end with actionable steps and how to book a personalized review. So, why this matters? Annual enrollment is a once a year window that determines coverage for the next calendar year. So that would be an effective date of January 1st, 2026. For 2026, the open enrollment period, also called annual enrollment period, runs from October 15th through December 7th. That's when beneficiaries can change Medicare Advantage plans, join or switch a Part D drug plan, or go back to original Medicare. As mentioned, coverage changes take effect January 1st, 2026. Of course, there is the open enrollment period that starts January 1st to March 31st. And that could be one more change to your Medicare Advantage plan or drug plan. If you are an agent, these months are mission critical. If you're a beneficiary, small timing mistakes can cost money and access. So we'll walk through the policy and marketplace shifts you must know before you pick up the phone or hit the mailbox. So let's talk about the government and regulatory headlines for 2026 with these headlines. CMS finalized a set of contract year 2026 policy changes that touch Medicare Advantage, Part D, DSNPs, which is your special needs plans, star ratings, and prescription drug programs. These are not minor tweaks, they're intended to modernize benefit design and enforcement across the board. So, on payments, Center of Medicare Services expect government payments to Medicare Advantage plans to increase. Payments were projected to rise on average 2026 updates, which changes the economics for carriers and could influence plan design premiums offered to beneficiaries. So keep in mind with these Medicare Advantage plans, the insurance carriers definitely do have to send in approval every single year to Medicare. And that's why there's always changes every single year because um, the insurance carriers try to make the benefits better or however they seem justly for their company, and they send it up to Medicare. One more big regulatory shift to flag, Center Medicare Services adjusted measure weights in the star ratings calculation for 2026, notably decreasing the weight of some patient experience and access measures. That changes affects how plans emphasize patient surveys versus clinical process measures. Agents should expect carriers to respond by rebalancing member outreach and quality improvement investments. So, with the star ratings, the higher the star rating, the more money the insurance company gets for Medicare for the level of care, right? Sometimes, though, the star ratings are just tweaked or not, it doesn't show maybe the whole picture, and where there was a few insurance companies that actually sued Medicare for unjust star ratings because they had said Medicare changed their criteria along the year, and some of them actually won and got more money, in turn, pass it on to the consumer. But there were companies that did not get it adjusted as well. So now let's talk about the cost and beneficiary impact and what consumers need to budget for. We've seen projected increases in beneficiary costs for 2026. CMS projections and multiple analysis indicate higher Part B premiums and Part D base costs for many beneficiaries, figures that could be substantial for people on fixed incomes. Experts are recommending agents proactively talk about budgeting and IRMA, which is income based adjustment planning. So, what does that mean on the ground? Even beneficiaries that are happy with a current plan should review it. Changes to premiums, formularies, or provider networks could change total out of pocket cost material. Uh, Definitely true. Um, I would say that the Part B premium costs probably be higher. The Part B D, um, the max out of pocket for your prescription drugs was 2000. It will increase to 2100, and then there are some deductibles that are increasing as well. So like there are carriers that are definitely increasing deductibles or having a deductible. So that's the thing that patients should keep in mind. Their plan might have been great last year or this year, but things are changing, benefits are changing. Formularies, which is really what prescription drugs the insurance company takes, will also change. So let's talk about the carriers and the marketplace dynamics heading into 2026. The big national carriers, say United Health, CVS/Aetna, Humana, Elevance, which is Anthem, Cigna and Centene, which is WellCare, continue to dominate the Medicare Advantage market share, but expect more tactical moves. They may narrow their networks in some markets. They may target benefit packages for specific populations, such as chronic care, and continued investment in valued based arrangements with health systems. The competitive race on supplemental benefits and cost sharing design will be intense. So some regional players are getting squeezed but can still win with local provider ties and superior member experience in specific counties. For agents to know which carriers dominate your county and why, and that's often what matters most to beneficiaries. So the thing is, I would say blanket statements of what insurance company is best for you. It's going to really depend on your geographical area. Every part of the country is just going to be different. Um, Different carriers really target and focus on different types of patients. Example, like your chronic care. The biggest ones is diabetes and heart conditions is a big one. So carriers may get more money from Medicare for helping clients with those conditions. However, in the past, it has been really lax who has a chronic condition, but now that is definitely tightening up, meaning that insurance companies may have more requirements. They will check your prescription drugs if you do have that chronic condition, or they will have a call to your doctor or request your doctor to attest that you do have that chronic condition. So things like that in the marketplace where many were relying on utility cards and grocery cards, and that might be going away for you. So that's something you definitely need to make sure. on that. Um, let's go back to star ratings, why they matter to beneficiaries and insurance companies. Star ratings drive consumer perception, like the government bonuses and marketing opportunities that these insurance companies have. So for 2026, a majority of Medicare Advantage enrollees are still in higher rated plans, but the distribution shifted. Some carriers moved up and others down. So plans that lose stars may lose bonus payments and marketing advantages, which in turn can affect year's benefits and network choices. So agents use a 2026 star list when you present options to clients. Okay. So yeah, I just can't stress the amount of changes that are occurring and that may affect you. Let's talk about technology trends affecting Medicare in 2026. So, tech is changing how members engage, expanded telehealth coverage, remote monitoring for chronic disease, digital prior authorization pilots. I've talked about that in other episodes, and more provider billing data flowing into plan analytics. CMS guidance and pilot programs have encouraged telehealth access and digital tools. Beneficiaries increasingly expect virtual care options and digital plan tools. Agents should be ready to discuss telehealth availability, remote services, and how plans support virtual visits or home health tech. AI is appearing more in marketing and operations, from chat bots or carrier websites to predictive outreach for star measures. But keep in mind, privacy, HIPAA, and regulatory oversight still remain. Agents should confirm how carriers use member data before recommending tech heavy plans. Yep. So, you never know if you're calling your insurance company and really an AI person is actually the one you're talking to. It's crazy. Some of them sound really good, but I'm still old school and I still want my clients to talk to a real person. So we will see. With tech too, it's not gonna be 100% accurate sometimes when you use quoting engines. Your doctors may still not be in or out of network. Your prescription drugs may not be the same price on there. So really, please do your diligence on that. Okay. So let's talk about prescription drug landscape and your Part D negotiation impact. Um, so 2026 continues um, to reflect the broader national conversation about prescription drug pricing. CMS has furthered price negotiation programs, and the Part D framework continues to evolve, which impacts formularies and tiering. For many beneficiaries, a Part D premium, deductible, and copays could shift, and some medications may move tiers to require new utilization edits. So, action items for agents: pull the 2026 formulary and run a personal drug check for each client. Small changes in tier placement or preferred generic substitutions can change costs significantly. Big thing, guys. Yes, due to the Inflation Reduction Act that happened this year in 2025, with a cap of drugs being 2,000 versus 8,000, that definitely put in a squeeze with insurance companies. That's why they have changed their drug formularies, um, benefits. There's a lot going on. In this instance, um, there's a lot of plans terminating or exiting or changing their name or not being discontinued and not being offered. There's just a lot going on, and it's been happening for the last few years. And hopefully, things will definitely stabilize in a few years. So, agents and agencies, compliance, marketing, and opportunity. What does this regulatory and market turbulence mean for agent and agencies? Definitely more compliance. That's going to intensify with more CMS guidance. Carriers will enforce agent appointment and marketing rules, keep your contract paperwork current, and document scope of appointment and marketing disclosures. So, some of this is not new, but enforcement tends to tighten years with major policy changes. So, seniors, scope of appointment is a form that you do have to sign before an agent talks to you about Medicare plan options. So there's a 48 rule where you do have to sign that before they talk to you. So when you have these cold callers calling you without a scope of appointment, they are not in compliance and they are not the ethical agents that you want in your life. Um, we have rules, we should follow them, and it's not fair for those that follow the rules that others don't. Of course, if you are walking in or calling in, that 48-hour rule does not apply, but you still need to get that scope of appointment verbally or in writing. So marketing shifts, digital channels also are growing, targeted outreach with that. Agents, definitely could use that and show comparisons and so forth. So definitely the opportunity. I believe about 50% of seniors will look into reviewing their plan, and then that next 50% will definitely change their plan. So, how agents structure AEP operations. So, we do standardize our process. We definitely could prepare digital kits like the scope of appointments, plan comparisons, and so forth. With dealing with a licensed independent agent, definitely they need to know how to find plans for you, how to personalize plans for you, and good agents are busy agents. So keep that in mind. So, the biggest thing is benefits first, right? So, we are offering plan option changes and just a benefit guide. 15-minute review of your drug and provider coverage to see if we can save you money or improve access. So, we definitely need to run drugs to make sure your drugs are on the formulary for your current meds. So, if they are generic or preferred generic, they should be very little or zero cost, but your drug could be, say, a tier 3 versus a tier 2, depending on the plan. Providers, we definitely do have to confirm primary care and specialists remain in network because you don't know. Doctors and medical groups do change their contracts. Medical groups are always in negotiation with these insurance companies. Comparing premiums could definitely increase, deductibles could definitely increase, and the estimated annual out of pocket costs increases. So that's going to be the big surprise when some insurance companies are charging a deductible on your tier 3 prescription drugs. That's what I've been noticing the most. And then just examining benefits like the supplemental benefits like the dental, vision, hearing, transportation, meals, telehealth, all those, some are eliminating those, some are drastically changing, and a few are actually increasing. So, how do you know? You got to review. So, if anything looks off, definitely present alternative plans and exact dollar differences. I know everyone would want concrete numbers based on their individual. So, some commonly asked questions recently. Should I stay in my Medicare Advantage plan if my premium goes up? Well, let's not focus on premium as a whole. We got to compare the total expected yearly cost, provider access, and drug coverage. Am I going to lose coverage if my plan loses stars? Well, not immediately. Star changes influences bonuses and payments, which can affect next year's benefits or plan offerings, but members don't automatically lose coverage mid-year. So find actionable steps. Bottom line, definitely mark your calendar for October 15th to December 7th for annual enrollment period. Change goes in effect January 1st. Run your drugs early. And then really understand how the Part D and the Part B cost changes and IRMA apply for a client. So, definitely. I mean, I urge you 2 more days coming up for the annual enrollment period. Find that trusted um, insurance agent as myself and my company, Premier 360, and just make sure, be it a just 5-minute phone call to make sure you are on the right plan, that your costs are not going to skyrocket, that your benefits are just not going to decrease dramatically, is the biggest thing. And of course, if you want to keep your doctors, your medical groups, it is also important to check. And then also the biggest thing is like, if you do it all online, if you're a do-it-yourselfer, your online is not going to show if your doctor's online in a medical group, what medical group they're in. So that's kind of the biggest thing. Sometimes a client will show me all their all the homework they did to come to find out that I tell them, yes, maybe it's a great plan, but your doctor is not in that plan, or it's geared to a specific Medicare group, medical group. So things like that, it's just not the things that you read, right? With having an experienced licensed independent agent that actually knows the plans in and out, could guide you in that process, is going to make a big difference. Can't stress it enough. Do not talk to those cold callers that call you because they're not in compliance. If you did not ask them to call you, they shouldn't be calling you. And it hurts and affects the agents and agencies that are trying to, that are doing this right, that are following compliance guidelines from Medicare. So I hope you enjoyed today's Medicare 360 show. Definitely, if you are a client or just a senior that wants to review their Medicare, please don't hesitate to reach out to us. And if you're an agent, we definitely could help you, guide you along the process, as some agencies may not help you as much to go over and learn the ins and outs on how to have a successful annual enrollment period. Well, this is a great episode. I look forward to seeing you in the next. Have a great one. Thanks. Bye bye.